Hello guys, this is Amat Khalik and today I'm going to present on aggression. So moving on to how to define aggression. Social psychologists define aggression as a behavior that is intended to harm another individual who does not wish to be harmed. Because it involves the perception of intent, what looks like aggression from one point of view may not look like that way from another. And the same harmful behavior may or may not be aggressive depending on its intent. So you can see that this definition rules out some behaviors that we might actually think are aggressive. For instance, we can say a football linebacker who accidentally breaks the arm of another player or driver who accidentally hits a pedestrian would not, by our definition, be displaying aggression because although harm was done, but there was no intent to harm that individual. So, like, there's another example like a salesperson who attempts to make a sale through repeated phone calls is not aggressive because he's not intending to do any harm. We should say that this behavior is more assertive rather than aggressive, and not all intentional behavior that hurts others are aggressive behaviors. A dentist might intentionally give a patient a painful injection or of a painkiller, but the goal is to prevent further pain during the procedure. Okay, so moving on to violence. Violence is a subset of aggression. Uh, the term violence refers to aggression that has extreme physical harm, such as injury or death as its goal. This violence is a subset of aggression. All violent acts are aggressive, but only acts that are intended to cause extreme physical damage, such as murder, assault, rape, or robbery, are violent. Slapping someone really hard across the face might be violent, but calling people names would only be aggressive. Okay, so moving on to different types of aggression. There are basically four types. The type or level of intent that underlies an aggressive behavior creates the distinction between two fundamental types of aggression, which are caused by very difficult psychological processes. Emotional or impulsive aggression refers to aggression that occurs with only a small amount of forethought or intent that is determined primarily by impulsive emotions. Emotional aggression is the result of the extreme negative emotions we are experiencing at the time that we aggress and is not really intended to create any positive outcomes. So moving on to cognitive aggression. Uh, is aggression that is intentional and is planned. Instrumental or cognitive aggression is more cognitive than um, effective and may be completely cold and calculating. Instrumental aggression is aimed at hurting someone to gain something like attention, some kind of reward, or like political power. Um, okay, if the aggressor believes that there is an easier way to obtain the goal, the aggression would probably not occur. A bully who hits a child and steals her toys, a terrorist who kills civilians to gain political exposure, and a hired assassin are all good examples of instrumental aggression. Okay, and then there comes physical aggression. Social psychologists agree that aggression can be verbal or physical. Therefore, slinging insults at a boyfriend is definitely according to our definition aggressive, just as hitting someone is. Physical aggression is aggression that involves harming others physically, for instance, hitting, kicking, stabbing, or shooting them. Non physical aggression is aggression that does not involve physical harm. Non physical aggression includes verbal aggression like yelling, screaming, and swearing at people. Okay, and then here's some examples of non physical aggression, like gossiping or spreading rumors or bullying some kid, like turning people against each other, like I think there could be some politics involved in that too. Like yeah, I think like that's what they do in politics. Like they turn people against each other, and um, just try to get them like under their influence. So that's what they try to. That's what I think. They're dismissing the opinions of others, stealing a boyfriend or girlfriend, threatening to break up with partner if the partner does not comply, or like flirting with another person to make a partner jealous. Okay, so moving on to treatment. Um, the National Fragile X Foundation states that a patient with aggressive behavior has poor impulse control. Behavioral therapy works by finding the cause of the aggressive behavior and then teaching the patient how to control the impulses that lead to those behaviors. This type of therapy also helps the patient identify the triggers of the aggression so that he can avoid them. The therapist may use role play to teach the patient the consequences of her behavior, especially if the patient is a child. Okay, there's some medication that can reduce severity of impulses, which can stop the aggressive behavior. The medications for aggression target neurotransmitters such as gamma, aminobutyric acid, dopamine, and serotonin. The Society of Neuroscience notes that risperidone, a medication to use schizophrenia, has been used to treat the aggressive behavior in juvenile conduct disorder. A patient with juvenile conduct disorder directs his aggression at people and animals with abuse and inanimate objects through vandalism, which, given risperidone, uh, patients with juvenile conduct disorder exhibit important behavior after 7 weeks. So that'd be all for my presentation. Thank you, guys.